Question 1. In the context of myocardial perfusion imaging MPI, a 56-year-old patient with a history of stable angina undergoes an exercise stress test. The resulting images show a large area of reduced perfusion in the anterior wall of the left ventricle, which reverses after the stress. Which of the following best describes the findings observed in this patient? A. Acute myocardial infarction with irreversible damage. B. A normal variant with no significant coronary artery disease CAD. C. Ischemia with reversible perfusion defects due to coronary artery disease CAD. D. Heart failure with preserved ejection fraction HFpEF causing the perfusion defect. Answer. Correct answer. C. Ischemia with reversible perfusion defects due to coronary artery disease CAD. Explanation. The key feature in this patient's MPI study is a reversible perfusion defect, which typically indicates ischemia due to CAD. The perfusion defect appears during stress and resolves after rest, suggesting that the myocardial tissue is not permanently damaged and the ischemia is reversible. This finding is characteristic of CAD and ischemia, where coronary arteries narrow or temporarily occlude, reducing blood flow to the myocardium during stress. In contrast, an acute myocardial infarction, choice A, would typically show irreversible damage. HFpEF, choice D, does not usually present with localized perfusion defects in the absence of other findings. Question 2. Given the circumstances of a nuclear cardiology lab using a gamma camera for myocardial perfusion imaging (API), which of the following factors can cause attenuation artifacts in the SPECT images? A. Incorrect patient positioning during image acquisition. B. Improper filtering of raw image data. C. Use of a low-energy, high-resolution collimator. D. Incorrect dose of radiopharmaceutical administered to the patient. Answer. Correct answer. A. Incorrect patient positioning during image acquisition. Explanation. Attenuation artifacts in SPECT imaging occur when the radiopharmaceutical is absorbed by the body tissues, leading to a reduction in the amount of gamma radiation reaching the detector. Incorrect patient positioning, such as misalignment of the body relative to the camera, can cause variations in the radiation detected, leading to poor image quality and attenuation artifacts. The use of a low-energy, high-resolution collimator, choice C, typically does not directly cause attenuation artifacts but could reduce sensitivity. Radiopharmaceutical doses, choice D, may affect the quality but do not cause attenuation. Proper filtering, choice B, helps improve image clarity but is unrelated to attenuation. Question 3. In light of recent developments in nuclear cardiology, consider a patient who is undergoing a pharmacological stress test with adenosine. Following the administration of adenosine, the patient develops transient chest pain, dizziness, and mild shortness of breath, but these symptoms resolve within a few minutes. What should the nuclear cardiologist do next? A. Immediately administer nitroglycerin to alleviate the symptoms. B. Proceed with the imaging protocol without any delay. C. Discontinue the test, monitor the patient closely, and provide supportive care. D. Administer a second dose of adenosine to achieve the desired stress response. Answer. Correct answer. C. Discontinue the test, monitor the patient closely, and provide supportive care. Explanation. Pharmacological stress agents like adenosine can occasionally cause side effects, including chest pain, dizziness, and shortness of breath. Although these symptoms typically resolve once the medication is metabolized, the nuclear cardiologist must prioritize patient safety. The appropriate action is to discontinue the test, monitor and provide supportive care until the symptoms subside. Nitroglycerin, choice A, could be used if the chest pain persists, but it is not the first-line intervention. Proceeding without delay, choice B, or administering a second dose of adenosine, choice D, could exacerbate symptoms and is not recommended. Question 4. A fundamental question is, how does the use of attenuation correction in SPECT myocardial perfusion imaging (MPI) improve image quality in obese patients? A. By correcting for light scatter from the patient's body. B. By adjusting for changes in heart rate during the scan. C. By compensating for soft tissue attenuation that can distort myocardial images. D. By improving the resolution of images obtained from the gamma camera. Answer. Correct answer. C. By compensating for soft tissue attenuation that can distort myocardial images. Explanation. Attenuation correction is critical in SPECT MPI for obese patients as excess body fat can significantly reduce the amount of gamma radiation reaching the detector, leading to artifacts and distorted images. By using attenuation correction algorithms, the system compensates for the effects of soft tissue absorption, particularly in areas like the diaphragm and chest wall where attenuation is most pronounced. This process improves image clarity and accuracy, allowing better identification of perfusion defects. It does not affect resolution directly, choice D, or correct for heart rate, choice B, nor does it address light scatter, choice A. Question 5. What would happen if a patient undergoing a nuclear cardiology study was inadvertently administered the wrong radiopharmaceutical? A. The imaging procedure would be delayed and the patient would need to be rescheduled. B. The study results would be accurate but may require additional interpretation. C. The incorrect radiopharmaceutical would cause misleading results and the study should be repeated. D. The results would be normal and no further action would be required. Answer. Correct answer. C. The incorrect radiopharmaceutical would cause misleading results and the study should be repeated. Explanation. Administering the wrong radiopharmaceutical in nuclear cardiology can lead to misleading or inaccurate imaging results. And each radiopharmaceutical is designed to target specific biological processes such as myocardial, perfusion, or metabolism. Using the wrong agent could lead to erroneous images, misdiagnosis, or an incomplete evaluation of the cardiac condition. As a result, the study must be repeated with the appropriate radiopharmaceutical to ensure reliable results. Question 6. Based on the information provided by the clinical history of a 68-year-old male with suspected coronary artery disease cared undergoing myocardial perfusion imaging (MPIA), which of the following would be considered an ideal pharmacological stress agent for this patient? A. Dobutamine. B. Nitroglycerin. C. Adenosine. D. Exercise treadmill test. Answer. Correct answer. A. Dobutamine. Explanation. For patients who are unable to undergo exercise stress testing, such as those with mobility issues or physical limitations, dobutamine is a common pharmacological stress agent. Dobutamine works by increasing heart rate and myocardial contractility, mimicking the effects of exercise. Nitroglycerin, choice B, is typically used for angina relief but does not serve as a stress agent. Adenosine, choice C, is often used in patients with asthma or obstructive pulmonary disease but may not be suitable for all CAD patients due to its vasodilatory effects. The treadmill test, choice D, is a physical stress test and would not be ideal for this patient. Question 7. Under the assumption that a nuclear cardiology lab uses both SPECT and PET imaging for myocardial perfusion, which of the following is the primary advantage of PET over SPECT in cardiac imaging? A. PET provides more accurate attenuation correction for obesity. B. PET uses lower doses of radiopharmaceuticals compared to SPECT. C. PET has superior spatial resolution, allowing for better myocardial imaging. D. PET imaging is less expensive than SPECT and widely available. Answer. Correct answer. C. PET has superior spatial resolution, allowing for better myocardial imaging. Explanation. PET imaging offers superior spatial resolution compared to SPECT, allowing for more detailed images of myocardial perfusion and function. This increased resolution helps in the detection of small perfusion defects and better assessment of myocardial viability. PET is also more sensitive in detecting ischemic areas, especially in patients who may suffer from attenuation artifacts in SPECT. Although PET may provide better attenuation correction, choice A, its primary advantage lies in spatial resolution. PET is more expensive than SPECT and requires specialized equipment, making it less widely available. Choice D. Question 8. What factors contribute to the development of artifacts in nuclear cardiology images and how can they be mitigated? A. Incorrect filter application and insufficient radiation shielding. B. Patient motion, improper image acquisition settings, and incorrect reconstruction algorithms. C. Use of outdated software and failure to calibrate the gamma camera. D. All of the above. Answer. Correct answer. B. Patient motion, improper image acquisition settings, and incorrect reconstruction algorithms. Explanation. Artifacts in nuclear cardiology images often result from patient motion during image acquisition, which can lead to blurring or misalignment of the image. Improper acquisition settings, such as incorrect positioning or timing, can also distort results. Additionally, incorrect image reconstruction algorithms may introduce artifacts. To mitigate these issues, it's essential to ensure that the patient remains still during the procedure, adjust acquisition settings appropriately, and use the correct algorithms during image reconstruction, radiation shielding, and calibration of equipment. Choices and C are important but not primary causes of artifacts. Question 9. Which of the following is the most significant aspect of interpreting myocardial perfusion imaging (MPI) studies? A. The use of a high-resolution gamma camera. B. Integration of clinical history and risk factors with imaging findings. C. Focusing solely on visual assessment of the images without considering other tests. D. Prioritizing the results of the stress test over the rest of the clinical information. Answer. Correct answer. B. Integration of clinical history and risk factors with imaging findings. Explanation. The most important aspect of interpreting MPI studies is the integration of the imaging results with the patient's clinical history and known risk factors. This comprehensive approach allows for accurate diagnosis, risk stratification, and treatment planning. Focusing solely on the imaging findings, choices C and D, or relying on imaging technology alone, choice A, overlooks critical patient-specific factors that could influence the diagnosis. Question 10. When considering a patient with a suspected acute coronary syndrome, ask which of the following imaging findings on myocardial perfusion imaging (MPI) would be most concerning? A. Reversible perfusion defects with normal resting ejection fraction. B. Fixed perfusion defects with regional wall motion abnormalities. C. Diffuse mild perfusion defects throughout the myocardium. D. Normal perfusion with no regional wall motion abnormalities. Answer. Correct answer. B. Fixed perfusion defects with regional wall motion abnormalities. Explanation. Fixed perfusion defects with associated regional wall motion abnormalities suggest irreversible damage, which is highly concerning in the context of acute coronary syndrome (ACS). These findings are consistent with myocardial infarction, where myocardial tissue has been permanently damaged due to prolonged ischemia. Reversible defects indicate ischemia, but not infarction. Diffuse mild defects, choice C, are often seen in conditions such as microvascular disease, and normal findings, choice D, would not be concerning in ACS. Question 11. In light of recent developments in nuclear cardiology, Mr. Garcia is undergoing a myocardial perfusion imaging (MPI) study with SPECT to evaluate coronary artery disease. During the scan, the technologist notices that there is significant attenuation, which could affect the quality of the image. What would be the most appropriate course of action? A. Continue with the scan and adjust the protocol for better image acquisition. B. Administer a second dose of the radiopharmaceutical and restart the imaging protocol. C. Use attenuation correction techniques and inform the physician of the potential impact on the results. D. Cancel the test immediately and reschedule the patient for another day. Answer. Correct answer. C. Use attenuation correction techniques and inform the physician of the potential impact on the results. Explanation. Attenuation correction techniques, such as using CT or SPECT-based methods, are essential for improving image quality by compensating for the absorption of radiation due to tissue density variations. In clinical practice, attenuation can be caused by obesity, breast tissue, or diaphragmatic activity, which must be accounted for to ensure the MPI results are not misleading. Option C ensures that the technologist addresses the issue while continuing to collect valid data. Attenuation correction is a standard procedure to improve diagnostic accuracy in SPECT MPI. Guidelines from EANM and EACVI emphasize its importance for reliable results in coronary artery disease diagnosis. Question 12. Considering the evidence from clinical studies, how does exercise stress testing for myocardial perfusion imaging (MPI) help in the assessment of coronary artery disease (CAD)? A. Exercise stress testing is used to monitor the patient's heart rate during the procedure but does not provide additional diagnostic value. B. It enhances the sensitivity of the MPI by inducing stress-related changes that can highlight areas of ischemia. C. It serves as A treatment protocol to mitigate the effects of coronary artery disease during the imaging procedure. D. Exercise stress testing is primarily used to assess the radiopharmaceuticals before injection. Answer. Correct answer. B. It enhances the sensitivity of the MPI by inducing stress-related changes that can highlight areas of ischemia. Explanation. Exercise stress testing increases myocardial oxygen demand, which can cause ischemic regions of the heart to show reduced perfusion during MPI. This dynamic information is invaluable for detecting coronary artery disease, as ischemia is often present when there is an imbalance between supply and demand. This concept is supported by clinical guidelines from the American College of Cardiology (AC) and EACVI, which advocate for stress testing to improve diagnostic accuracy. Option B correctly highlights the role of stress in detecting ischemic changes in MPI. Question 13. In the context of myocardial perfusion imaging MPI, which of the following is a key feature of gated SPECT imaging for assessing left ventricular function? A. It primarily focuses on myocardial perfusion without considering the heart's mechanical function. B. It measures wall motion abnormalities and calculates ejection fraction, providing a comprehensive assessment of left ventricular performance. C. It utilizes a single photon emission tomography SPECT scan but does not incorporate any functional analysis. D. It requires the patient to undergo additional pharmacological stress testing. Answer. Correct answer. B. It measures wall motion abnormalities and calculates ejection fraction, providing a comprehensive assessment of left ventricular performance. Explanation. Gated SPECT imaging combines myocardial perfusion imaging with functional data derived from simultaneous electrocardiogram (EAC) gating. This allows for the assessment of both the regional perfusion and mechanical function of the left ventricle. It calculates ejection fraction, identifies wall motion abnormalities, which are crucial for evaluating cardiac function and detecting ischemia. This is a standard procedure in clinical practice for assessing left ventricular function and guiding therapeutic decisions, as outlined in EACVI and EANM guidelines. Question 14. A growing trend in nuclear cardiology involves the use of PET imaging. What is the primary advantage of using PET for myocardial perfusion imaging compared to traditional SPECT? A. PET provides higher resolution images, improving diagnostic accuracy by detecting smaller areas of ischemia. B. PET is less expensive and faster than SPECT, making it more suitable for routine clinical use. C. PET is used exclusively to evaluate coronary artery disease, unlike SPECT, which can evaluate other conditions. D. PET provides better attenuation correction but does not offer functional information like SPECT. Answer. Correct answer. A. PET provides high-resolution images, improving diagnostic accuracy by detecting smaller areas of ischemia. Explanation. PET imaging offers superior spatial resolution compared to SPECT, allowing for more precise detection of myocardial perfusion abnormalities and small ischemic regions. This is particularly valuable in patients with subtle coronary artery disease where high-resolution imaging is essential for diagnosis. While PET can be more expensive and less widely available than SPECT, its ability to detect smaller ischemic areas and assess myocardial viability with high accuracy makes it a valuable tool for cardiologists, as supported by the EACVI guidelines. Question 15. What factors contribute to a significant reduction in the accuracy of myocardial perfusion imaging (MPI) results? A. Incorrect patient positioning during the scan leading to motion artifacts. B. A consistent low-quality radiopharmaceutical used for imaging. C. Both A and B. D. Excessive physical activity before the scan. Answer. Correct answer. C. Both A and B. Explanation. Several factors can significantly reduce the accuracy of MPI results. Motion artifacts caused by incorrect positioning or patient movement during the scan are a well-known source of image degradation. Additionally, the use of suboptimal radiopharmaceuticals, such as those that are past their expiration date or improperly stored, can lead to poor quality images. According to the EANM guide, high-quality imaging and proper patient positioning are essential for accurate diagnosis. Therefore, both motion artifacts and poor quality radiopharmaceuticals should be avoided for optimal results. Question 16. Upon closer examination, Mr. Lee is undergoing a pharmacological stress test with adenosine to evaluate myocardial perfusion. He experiences shortness of breath and chest discomfort during the procedure. What should the nuclear cardiologist do in this situation? A. Ignore the symptoms if they are transient and proceed with the imaging study. B. Discontinue the test immediately and assess Mr. Lee's condition to determine if any intervention is necessary. C. Administer nitroglycerin to relieve the symptoms and continue the stress test. D. Proceed with the imaging scan while monitoring the patient closely for further symptoms. Answer. Correct answer. B. Discontinue the test immediately and assess Mr. Lee's condition to determine if any intervention is necessary. Explanation. Adenosine-induced stress testing can cause transient symptoms such as shortness of breath and chest discomfort, but these should be carefully monitored. If symptoms persist or worsen, the test should be stopped immediately. The patient's well-being is paramount, and it is crucial to assess whether any intervention such as nitroglycerin administration or other measures is necessary. Discontinuing the test in response to symptoms is a standard practice to ensure patient safety, as emphasized in EACVI and EANM protocols. Question 17. A critical examination of pharmacological stress agent shows that adenosine is often used in MPI because it induces vasodilation. Which of the following is a mechanism of action of adenosine during pharmacological stress testing? A. It increases myocardial oxygen demand by increasing heart rate. B. It reduces myocardial oxygen consumption by lowering blood pressure. C. It induces vasodilation in healthy coronary arteries, mimicking exercise-induced stress. D. It acts as a beta-adrenergic antagonist to slow heart rate. Answer. Correct answer. C. It induces vasodilation in healthy coronary arteries, mimicking exercise-induced stress. Explanation. Adenosine works by inducing vasodilation of healthy coronary arteries, leading to an increased demand for blood flow in the myocardium, similar to the effects of exercise stress. This response helps to identify ischemic regions of the heart, as coronary stenosis or blockages will not dilate adequately. Adenosine-induced stress is commonly used in patients who are unable to exercise or those with contraindications to physical stress testing. This mechanism is central to its application in nuclear cardiology, as described in guidelines from EACVI and EANM. Question 18. According to recent studies, how does the use of PET imaging with 82RB compare to traditional SPECT for the assessment of myocardial perfusion? A. 82RB PET offers superior spatial resolution and better diagnostic sensitivity for detecting coronary artery disease. B. SPECT imaging is preferred over PET because of lower costs and faster imaging times. C. 82RB PET is less effective at assessing myocardial perfusion than SPECT due to lower resolution. D. There is no significant difference between PET and SPECT in the clinical assessment of myocardial perfusion. Answer. Correct answer. A. 82RB PET offers superior spatial resolution and better diagnostic sensitivity for detecting coronary artery disease. Explanation. PET imaging with 82RB offers superior spatial resolution and high diagnostic sensitivity compared to SPECT, which can improve the detection of even smaller ischemic regions. The ability to assess myocardial blood flow and metabolism in real time adds to its diagnostic power, especially in cases where SPECT might miss subtle perfusion abnormalities. This has been demonstrated in numerous studies and is supported by the latest EACVI and EANM recommendations. Therefore, 82RB PET has been recognized as a valuable tool for diagnosing coronary artery disease, particularly in high-risk patients. Question 19. Under the assumption that a patient has a high likelihood of coronary artery disease, CAD, which a nuclear cardiology test is best suited for assessing myocardial viability, A. Resting echocardiogram. B. PET imaging with a 18 FFG to assess myocardial viability. C. Cardiac MRI to evaluate myocardial perfusion. D. SPECT imaging with adenosine for pharmacological stress testing. Answer. Correct answer. B. PET imaging with 18 FFG to assess myocardial viability. Explanation. PET imaging with 18 FFG is widely used to assess myocardial viability. The 18 FFG tracer highlights viable myocardial tissue by measuring glucose metabolism, which is an important marker of viability in patients with CAD. This is especially useful in patients with previous myocardial infarctions where essential to determine whether the myocardial tissue is still viable for potential revascularization. This approach is outlined in guidelines from both EACVI and EANM, emphasizing its importance for assessing myocardial viability. Question 20. During the process of myocardial perfusion imaging, what is the primary purpose of using an egg-gated technique in SPECT imaging? A. To correct for motion artifacts by synchronizing the acquisition with the patient's respiratory cycle. B. To assess both myocardial perfusion and the mechanical function of the heart by synchronizing image acquisition with the cardiac cycle. C. To monitor the patient's heart rate and adjust the imaging protocol based on real-time changes. D. To improve image quality by enhancing the resolution of the myocardial perfusion images. Answer. Correct answer. B. To assess both myocardial perfusion and the mechanical function of the heart by synchronizing image acquisition with the cardiac cycle. Explanation. Egg-gating in SPECT imaging synchronizes image acquisition with the cardiac cycle, allowing for both perfusion and functional assessment of the heart. This technique provides valuable data on left ventricular function, including ejection fraction and wall motion, in addition to perfusion abnormalities. This is particularly useful in assessing the severity and extent of coronary artery disease as outlined in EACVI guidelines. By integrating perfusion data with mechanical function, egg-gated SPECT offers a comprehensive evaluation of cardiac health. Question 21. In a clinical scenario, a patient undergoes myocardial perfusion imaging and PI with SPECT. After reviewing the images, it appears there is a significant amount of attenuation in the inferior wall. Which of the following would be the best course of action to improve the diagnostic quality of the image? A. Repeat the scan with a higher radiopharmaceutical dose. B. Apply attenuation correction techniques and inform the physician about the possible impact on the results. C. Change the imaging angle to better visualize the inferior wall. D. Discontinue the study and recommend an alternative imaging modality such as MRI. Answer. Correct answer. B. Apply attenuation correction techniques and inform the physician about the possible impact on the results. Explanation. Attenuation in myocardial perfusion imaging, particularly in the inferior wall, can significantly affect the diagnostic accuracy of the scan. Attenuation correction techniques, which are available in modern SPECT and PET imaging, help mitigate these issues by adjusting the images to account for density variations in the e.g. diaphragmatic attenuation. The physician should be informed of any potential impact on diagnostic results, as this could affect the final interpretation. Applying attenuation correction is standard practice in such cases. Question 22. A patient is scheduled for a myocardial perfusion study using PET imaging with 82RB. The cardiologist requests the use of pharmacological stress agents. Which of the following stress agents is commonly used during PET imaging with a 82RB? A. Adenosine. B. Dipyridamole. C. Regadenoson. D. All of the above. Answer. Correct answer. D. All of the above. Explanation. All of the listed pharmacological stress agents, adenosine, dipyridamole, and regadenoson, are commonly used in conjunction with PET imaging using a 82RB. These agents induce vasodilation to mimic the effects of exercise stress, allowing for the evaluation of myocardial perfusion. Regadenoson, in particular, is often used because it has more favorable side effect profile compared to adenosine and dipyridamole. The choice of stress agent depends on the patient's and clinical scenario. Question 23. Mr. Patel undergoes a myocardial perfusion imaging MPI study with SPECT. The images show reversible perfusion defects in the anterior wall, which are more pronounced during stress than at rest. What is the most likely interpretation of these findings? A. The patient has a history of myocardial infarction, and the defects are due to scar tissue. B. The perfusion defects are likely due to ischemia caused by coronary artery disease, which improves at rest. C. The defects represent normal physiological variations in perfusion and do not require further investigation. D. The defects indicate a technical artifact and should be dismissed. Answer. Correct answer. B. The perfusion defects are likely due to ischemia caused by coronary artery disease, which improves at rest. Explanation. Reversible perfusion defects that appear during stress and resolve at rest are characteristic of myocardial ischemia due to coronary artery disease. This is a common finding in patients with stenotic coronary vessels that limit blood flow during exertion but allow for full perfusion at rest. This suggests the presence of significant coronary artery disease, and further diagnostic or therapeutic intervention may be necessary. Question 24. When performing a myocardial perfusion imaging study using SPECT, it is important to standardize the imaging procedure. Which of the following is a critical factor in ensuring the accuracy of the study? A. The imaging system should be calibrated at least once every 6 months. B. The patient should fast for at least 12 hours before the study. C. The study should be conducted without the use of any contrast agents. D. The heart rate should be monitored during the scan to ensure optimal results. Answer. Correct answer A. The imaging system should be calibrated at least once every 6 months. Explanation. Regular calibration of the imaging system is essential to ensure accurate and reproducible results in myocardial perfusion imaging. Calibration ensures that the system is properly aligned, functioning correctly, and producing high-quality images, while patient fasting and heart rate monitoring are important factors in the overall procedure. Calibration is a critical step to maintain the reliability of the system and minimize potential imaging artifacts. Question 25. A 65-year-old male patient with known coronary artery disease is scheduled for a stress myocardial perfusion imaging and PI. A study using SPECT. He is unable to exercise adequately due to mobility issues. What is the most appropriate pharmacological stress agent to use in this scenario? A. Dipyridamole. B. Atropine. C. Adenosine. D. Exercise treadmill. Answer. Correct answer. C. Adenosine. Explanation. For patients who are unable to exercise adequately, pharmacological stress agents are used to simulate the effects of physical activity on the heart. Adenosine is commonly used in these cases as it induces coronary vasodilation and increases myocardial oxygen demand, mimicking the effects of exercise. While dipyridamole can also be used, adenosine is often preferred for its more rapid onset and shorter duration of action. Other agents like atropine are not typically used for this purpose. Question 26. In cardiology, myocardial viability assessment is crucial for determining the potential for revascularization in patients with coronary artery disease. Which imaging modality is most commonly used to assess myocardial viability? A. Myocardial perfusion imaging with SPECT. B. PET imaging with 18 FHE. C. Resting echocardiography. D. MRI with gadolinium contrast. Answer. Correct answer B. PET imaging with 18 FG. Explanation. PET imaging with 18 FFG is the most commonly used modality for assessing myocardial viability. This imaging technique evaluates glucose metabolism, which is a marker for myocardial viability. Areas with reduced glucose uptake but preserved perfusion often indicate hibernating or stunned myocardium, which may benefit from revascularization. While SPECT MRI can provide valuable information, PET with 18 FFG offers superior sensitivity for evaluating myocardial viability. Question 27. Mr. Jackson, a 55-year-old male, undergoes a myocardial perfusion imaging study using SPECT. His study shows a fixed perfusion defect in the anterior wall. What is the most likely interpretation of these findings? A. The defect represents a myocardial infarction with permanent scar tissue. B. The defect is reversible and indicates ischemia due to coronary artery disease. C. The defect is due to a technical error such as patient movement during the scan. D. The defect indicates an inflammatory condition affecting the myocardium. Answer. Correct answer A. The defect represents a myocardial infarction with permanent scar tissue. Explanation. Fixed perfusion defects that do not change between rest and stress imaging are characteristic of myocardial infarction where myocardial tissue is damaged and scarred. These defects represent areas of the heart that no longer receive adequate blood flow even at rest. In contrast, reversible defects are typically associated with ischemia to coronary artery disease. Therefore, a fixed defect strongly suggests a previous myocardial infarction. Question 20. In nuclear cardiology, the choice of radiopharmaceutical for myocardial perfusion imaging is essential for the quality of the study. Which of the following radiopharmaceuticals is commonly used for SPECT myocardial perfusion imaging? A. 82 Rb, B. 99 meters TC CertMedbry, C. 18 FFG, D. 123 IMIG. Answer. Correct answer. B. 99 meters TC CertMedbry. Explanation. 99 meters TC CertMedbry is the most commonly used radiopharmaceutical for myocardial perfusion imaging with SPECT. It is highly effective at visualizing myocardial perfusion and has excellent tissue uptake and retention properties, allowing for clear imaging of the heart muscle. 82 Rb is typically used in PET imaging, 18 FFG is for viability studies, and 123 IMIG is used for cardiac sympathetic imaging, but none of these are as widely used for routine perfusion imaging as were 99 meters TC CertMedbry. Question 29. During the review of a myocardial perfusion imaging study, the nuclear cardiologist observes areas of decreased perfusion that are not consistent with coronary artery disease. What is the most likely cause of these findings? A. A normal variant in myocardial perfusion that requires no further evaluation. B. An artifact caused by patient motion during the scan. C. Myocardial ischemia caused by diffuse, non-obstructive coronary artery disease. D. A technical issue related to the imaging equipment. Answer. Correct answer. B. An artifact caused by patient motion during the scan. Explanation. Artifacts from patient motion, such as respiratory or involuntary movement, can cause areas of apparent decreased perfusion that do not correspond with actual myocardial ischemia. These artifacts can be mistaken for true perfusion defects, particularly if the motion occurs during key phases of the imaging cycle. It is important to rule out artifacts as a cause for perfusion defects by checking for motion during the scan and repeating the study if necessary. Question 30. In assessing myocardial perfusion imaging results, what role does the use of EACVI gating during SPECT imaging play in improving diagnostic accuracy? A. EACVI gating helps in quantifying myocardial perfusion defects without providing any information on heart function. B. EACVI gating allows for the assessment of both myocardial perfusion and the mechanical function of the heart by synchronizing imaging with the cardiac cycle. C. EACVI gating improves image resolution by enhancing the sensitivity of the radiopharmaceutical. D. EACVI gating is only useful for identifying arrhythmias during. Answer. Correct answer. B. EACVI gating allows for the assessment of both myocardial perfusion and the mechanical function of the heart by synchronizing imaging with the cardiac cycle. Explanation. EACVI gating is essential in SPECT imaging as it synchronizes image acquisition with the cardiac cycle. This technique allows for the evaluation of both myocardial perfusion, blood flow, and the mechanical function of the heart, e.g. ejection fraction, wall motion. This assessment improves diagnostic accuracy and helps to identify both ischemic areas and regions with functional impairment, providing comprehensive information about the patient's cardiac health. This is standard technique used in modern nuclear cardiology.